No.
All right.
Hello. Yep. Yep.
So I'd like to welcome everyone back. We're now going to move into our first panel session. Practical applications of AI in population health. This panel will be moderated by Sachin Lande, the Chief Technological Officer for the Center of Enterprise Architecture and the Washington Department of Health Office of Innovation and Technology. I'll let Sachin and the panel introduce themselves.
Hello, everybody. Good morning. What a lovely session we had this morning. Jonathan just kicked it off with some amazing, cool stuff which we can do. This session is about practical applications in AI and population health. I'm the Chief Technology Officer for the Department of Health. Recently took on this role. My role entails specifically around building the future state cloud architecture, starting with data strategy, and then building up with AI. I think my mic is gone back again. So I want to kick off with a couple of few things which how do we be running the panel. We'll spend about 30 minutes in more around the panel discussions. Then I will do about 10 minutes of Q&A, and then we'll wrap it up in about 5 minutes of wrap-up time, just if there are any open questions people may have. So what I want to take out of this session is more about how do we build and what are the key components of building the future state applications from a population health perspective, and how we look at the outcomes which are specific to that. So I just wanted to do a quick show of hands. How many of you believe that AI will fundamentally improve population health outcomes in the next decade? Just show of hands. Wow, awesome. We have an optimistic crowd. I'm really excited to hear that. And yes, we do see people who haven't raised their hands. They're cautious, and they're rightfully cautious about it. What Jonathan shared was something incredibly important for us. And I was making my mental notes. I was going through the session. I was kind of using my human intelligence. What are the key themes which Jonathan was kind of talking about? Was about human adaptability, data governance, and technology is there. But one thing which really stuck with me was demos are all good, but in real world things are different. So those are the three themes which I took off, and I want to, really take that moment in time, that how human intelligence and human adaptability and how we look at solving the problems of the population health from a practical perspective is something really going to be important. So with that said, I will start with the introductions. Taylor Linke, who's on the far left, is the Director of IT Innovations and Customer Experience at the Healthcare Authority, State of Washington. With 20 years of public service, she focuses on improving healthcare access through the use of innovative technology solutions rooted in human-centered design methodologies. Welcome, Taylor.
Thank you.
Alexander Sasha Secular from Google serves as an executive lead for healthcare and life sciences in Google Public Sector. He specializes in using cloud technologies and AI to drive healthcare innovation. Welcome, Sasha. Trisha is the Senior Advisor at the Office of National Coordinator of Health Information Technology. Her expertise includes pharmacy affairs, health strategy focusing on improving medication management and safety. She's currently focused on building capacity for and promoting the ethical, responsible use of AI at Health and Human Services. So I want to start with Taylor. Taylor, you're shepherding the human-centered design approach at HCA. And kind of going back to what we heard before, the human adaptability part of it, I wanted to hear, HCA serves about close to 2.5 million Washingtonians from a health insurance perspective. So looking at that, how's your agency, leveraging AI from the human-centered experience perspective?
Sure. So I love starting with people. So as Sachin said, I work at the State Healthcare Authority. And the Healthcare Authority, for those of you who may not be familiar, is the state agency responsible for the Medicaid benefits in our state, otherwise known as the Apple Health Program. Definitely in alignment with the Be Well WA Apple Health stress balls. I love those. And we also are responsible for the healthcare coverage of all state employees and school employees. And so, our lens that we look at things from is really from that access to coverage perspective. And my title is a little bit nebulous there, but really what that means is I get the honor of leading our sort of own Marvel Avengers superhero team. So for me, that's critical because at the heart of everything we do are the people that we serve. And we could have the best tool, as Jonathan mentioned, in AI, but if we don't know how it's impacting people or how people are going to respond to it, then it may not be a tool that actually provides benefit to us. And so, for me, it's about how do we iteratively build with those that are going to be impacted by the tool at the forefront of the table and in the conversation from the start. How do we consider the health equity conversations that we need to be having? Many of the people we serve in our programs are some of the most vulnerable populations in this state. Many of them don't have access to technology because they live in rural areas that we still haven't solved for, telecom efforts or issues with. And so we need to be considerate about all of those elements when we're thinking about a new technology implementation.
Excellent. I wanted to look at the trifecta. You mentioned people, technology, and policy. And policy is something which we heard also that we need to have the guidance around. So, Trisha, you focus on that aspect of it, and I would like to ask you a question around what are the current regulatory and policy barriers to adoption of AI in population health, and how do we address them to facilitate the innovation while addressing patient safety in an ethical way?
There's so much in there. So thank you for the question. So at ONC, we are now ASTP, so that's the exciting big news for us. So we are now the Assistant Secretary for Technology Policy. And we got this title by now being the leader for HHS's, AI work. And so a part of this, data is nothing new for ONC. We have been at the forefront of kind of managing health IT strategy and policy. And so it's an exciting time when we consider all that Jonathan mentioned about the need for data that really drives the power of a lot of these models. So we're excited to be leading a lot of those efforts. You mentioned safety. One of the things that I think, keeps us up at night is issues around transparency, issues around the explainability of models, individuals that are delivering healthcare, using these tools to make decisions. I mean, your worst, scenario is doing something and not understanding why. And so our HTI-1 regulation we introduced, our innovative, we think so, policy around requirements for developers to make available to end users certain source attributes about how those models work and what goes into some of the decisions that are being made in those tools. We think that's a part of what's necessary from a policy perspective in getting end users, clinicians, those that deliver and use these tools in healthcare settings to feel comfortable enough using them in these settings. When we think about safety, and this is some of the work that's not just being led by ASTP, AHRQ has a long history of running patient safety organizations, tracking health IT safety events and the like. And one of the things that we are realizing now is we can figure out where there might be a health IT safety event, but we don't have the certain lexicon or terminology to code and distinguish a health IT event that might be attributable to AI or the use of an ML algorithm or tool. And so if we think about how we're preparing for a world of how these tools are used and how we want to be able to one, harness the benefits and also track where we might want to do more interventions, we at this point don't have terminologies that help us to identify those things. And so that's just specific to the, what you asked about safety and the use of the tool. So, but in general at HHS, we are AI optimists. We are excited for the whole host of use cases that we plan to deploy across the department and across the health sector. But one of the things that we realize is that we keep getting asked from the health sector, what are the guardrails that HHS intends to put in place that gives us the freedom to play and to do the things? the majority of institutions are not going to be bleeding edge organizations that are leading the way in AI and ML. And so they are looking for guidance, and they're looking for the fence, so to speak, of how they can play in the space. What's going to be a challenge for us at HHS is that our regulatory cycle, there is a big disconnect between the regulatory cycle and what we see in the cycle of innovation in the field and in technology. And so we see changes happening on a 90-day sprint, whereas we're working on a fiscal year calendar, and our regs might take 2 to 3 years to come out. And so we have work to do in how we can get more agile in our policy making in ways that, one, provide some of that, those guardrails that folks are looking for, but is still flexible enough to realize that things are moving really quickly, and we don't ever want to be in the way of innovation.
Awesome. So that sets up with 3 things which kind of stood up for me. One was the governance part. You also talked about the agility to bring this application to the marketplace. And third, what are the core components, what you would need to build those applications? Sasha, I have a question for you to consider all these 3 components of AI governance. What are the core building blocks? And then when I say AI governance, I think more leaning towards data governance and the safety aspects of it. So I'm kind of, what are the real world problems? How do you see them? And what are the key areas, the guardrails part of it you would kind of comment on?
And thank you for the question. Excited to be here with everyone. Huge thank you to the State Department of Health and the University of Washington for coordinating this fantastic opportunity here for this room of people to get together and discuss these very important questions. You know, I travel a lot, and I'm very, very privileged to have the opportunity to sit in rooms like this with leaders who are moving the needle forward in the entire industry. And my mother's always texting me, "Where are you today? Where are you going?" etc. And so I wasn't quite sure, but I got here this morning and I texted her, "I'm at Camp David. This place looks like Camp David." And I'm really, I think about that because what do they do at Camp David? They bring a lot of people together to negotiate and execute all sorts of various diplomacy on very important issues. And that's the opportunity that we have to do here today and in other sessions like this around the particular questions that you asked. Whenever I have the opportunity to advise folks, the conversation is never really around the technology. It's always around the governance and the policy.
They can't hear you back.
They can't hear me in the back. How about now? Yes? No? Maybe? How about this? Okay. Thank you so much. Thank you so much. So the conversation is always around governance and policy. And for leaders in this room who are tasked with having this conversation amongst yourselves and your organizations, the organizations that you represent, the message that I bring to folks is be prepared. And as you saw from our keynote here, which was fantastic, of course, the technology wave that we're a part of right now is, I would say, revolutionary versus evolutionary. And you can think about that in many ways. The kind of capabilities and opportunities it will bring to ourselves as professionals, people who execute these programs within our environments, but then most importantly to the people who we serve within our communities. And what do I mean by be prepared? I recently had the opportunity to speak with the military health system at Walter Reed. They had a similar AI day where they convened hundreds of leaders throughout the military health system who were asking this question. And the military is really occupied with this word, readiness. And if you look up the definition of readiness, you'll see a couple of bullet points, and it means the will to do the thing. And when I speak with leaders, it's incumbent upon them to have the will to marshal their organizations to take advantage of these new capabilities. These capabilities, I liken these capabilities of AI to very special, very advanced jet engines or Formula One engines. What is it that we feed these engines? We need to feed them fuel. What's the fuel for AI? It's data. And so tactically, organizations, we advise, put in place the governance structures, the committees, data committee, privacy committee, AI committees, who all work collaboratively with each other, and then create the foundation by which AI will be delivered to. And as I said, AI requires the data, so having your data house in order is exceptionally important for the data that you collect, the data that you manage, and the data that you provide access to. These are roughly some of the key foundational components that everyone in this room and everyone I have the opportunity to speak with across the country and across the world has the ability to impact and is within their purview today. A lot of what we heard in the keynote is still very much forward-looking. And when I speak to organizations around how those things can be applied, they're in healthcare. They're broadly 5 domains: clinical, research, education, administration, and operations. And the feedback that I give is clinical is not the right place to apply these concepts today, outside of very well-defined areas, for 2 reasons. Number one, the technology is still being baked. If you look at the FDA and the certifications that they hand out for software as a medical device, 510Ks, et cetera, there are a handful of dozens of these capabilities that have already achieved certification in different areas of clinical application, many of them in medical imaging and adjacent areas, genetics. But they're still few and far between when you think about healthcare broadly. And it's difficult, not just for the technology, but the second reason is the people. The people who will use these technologies have not become accustomed to them. We need to create the trust. We need to create the confidence to use amongst the people who are professionals in our organizations to use these technologies. And that comes with time. And for a lot of the work that the technology teams like Google, like Microsoft, like Anthropic, and so many others do, it's incumbent on us to make these technologies transparent. Transparency breeds trust, breeds confidence amongst the users who will use these technologies. We know it's coming. As you see, the technology is useful today, and I often like to say it's the worst it will ever be. And they're growing on a geometric curve of usefulness. That means a year from now or 2 years from now, it's not twice as good. It might be 10 times as good. And so we need to be prepared to take advantage of those capabilities when they become available in the right domain at the right time. And being prepared is totally within our capacity today. We can do that right now. So hopefully that shares a little bit more on how we think about it.
Yeah, I want to delve into more of the preparedness part of it. Let's say, as an agency, we want to delve into the services side of it. I want to kind of see what do you mean by preparedness and how do you break it down further into creating that future state work?
I'll share a couple of words and I'll pass it on to my co-panelists here. When I often give these talks around this concept, I look at every leader in the room, and this is a collection of leaders in your various organizations, and I ask this question: look at the RFPs that you've written, your organizations have written over the last, retrospectively, take a look. Do those RFPs have bullet points that explicitly state the usage of standards, the promotion of integration, and the promotion of interoperability amongst the various systems that we've procured and spent so much money deploying and training our people on? it's incumbent on the people who buy these systems to write those concepts and concepts like them into those RFPs. It's part of being prepared. It's part of having your data house in order. What steps have your organizations taken to merge, integrate, make your data interoperable amongst the various systems in your purview? These are tangible, tactical opportunities for leaders to position yourselves to take advantage of these capabilities that we see here and we know are coming and have significant impact. They will have significant impact on all the business that we do. The concept that we share at Google is AI in and of itself is not a product. It's a class of features that enhance all the products you already use and all the workflows that are already parts of your environment. What does it mean to your budget when you can provide the same service to your growing populations at half the cost? Or something on that order. What kind of additional capabilities can you bring to your citizens? And where can you meet your citizens where they are by taking advantage of these capabilities? Because ultimately these technical advancements are net economic deflationary. So regardless of how you as an individual may think about these things, I can assure you that the world and in industries adjacent to healthcare are moving as fast as possible to implement these capabilities in their environments for this economic reason. What they can bring to their own environments from an economic perspective, because we all are asked to do more, and nobody's giving us double the headcount. So we have to apply these technologies as rapidly as possible. So these are some of the comments that we bring to the organizations that we advise, and I'd love to hear some of your thoughts.
Yeah, I'll add two more. Thank you, Sasha, for making the points on getting the data house in order and having standards in place. I'll add, absent the AI that we learn supervises itself and is in charge of its own self. We need resources to do the things. And you talked about willingness to do the things. We need willingness to do the things. And so I think, part of the AI readiness is really having some of the budgetary flexibility to, and comfort to be comfortable where we talk about this gradient of it's not necessarily you fail or you succeed. There is a pathway there and a process in place. And if we are just thinking in the fiscal year cycle or calendar year cycle, we will miss the opportunities to take things to their natural end of conclusion, which could be successful. And so being able to not be tied down by this project has to work within a definitive period of time or we move on and scrap it, being willing to find the funds to do the work and to drive innovation will be important. If I think about healthcare as a sector, for the longest we've been chasing this holy grail of value. We want to pay for outcomes and do all these things, but the point you made about us not truly being ready for clinical outcomes today means that we really have to be able to be ready to pay for efficiency gains now. So we have all these integrated insurance companies and all this, and what you see there is they're actually paying for efficiency all along the way. Mm-hmm. But every time you have the clinician that can come home earlier or can get things done faster, eventually we're going to get to better outcomes through the use of all these things. But I do think that we have to find ways to fund the work, and we have to find ways to, reward ourselves for the efficiency gains that aren't necessarily going to show up as an outcome in a patient right away. And also we just have to be willing to work on timelines that aren't our usual project cycles. And I think that institutional willingness is a cultural shift for a lot of organizations, including the government, because we work on appropriation cycles. We don't necessarily always, at the end of that appropriation cycle, we like to tell our appropriators what we accomplished. And sometimes it's a multi-year path and multi-year process, and we have to be okay operating in that area of gray or area of progress, not having reached where we might want to get. And so I think that's a part of the readiness that we need, the resources, the willingness to think differently about the project cycle, in addition to what you added and talked about as far as having the standards in place and having our data house in order.
Yeah, I love this conversation around readiness, because when I hear readiness, I hear maturity. And what I think about from a practical standpoint within my organization is on the infrastructure or organizational maturity, we're a little bit further along. So we have an AI ethics committee. We have really strong data governance processes. I mean, we're a state agency. We've got bureaucratic process on process, right? So that part we have down. But when I think about the other elements of maturity, you know, the technology readiness or maturity and the people maturity. So from a technology perspective, you know, we still have team members working in COBOL code. I mean, government is not great at having the newest technologies, right? So for us, in thinking about how do we apply AI, we want to focus first on the internal processes that we could apply AI to in order to gain the maturity with the people, the technologists who have to get comfortable with it before we start looking to deploy it on any of our external processes. So I'll give you an example. We are nowhere near being ready for Gen AI yet, but you know, we have been working to do the implementation of some bots. One of the bots, or a robotic process automation, is specific to helping our eligibility workers. Right now, they have to look in 14 different systems for data elements when they're talking to a beneficiary for coverage options. And so the bot essentially goes and looks at all of those different systems for them, pulls together the necessary data elements, and then presents the case to the eligibility worker so that everything is there the minute they look at it. They don't have to spend their time going and hunting things down. And we're doing that so that we can free up the human potential of the individual workers so that they can use their higher level thinking and skill sets for the interaction that they're having with the beneficiary, so that they don't feel so rushed in that interaction. They can have the conversations about what other benefits or services might that individual need. And so we really want to build that muscle memory or maturity first internally before we look externally. Because I think the other thing that, you know, we've found is that when you talk about AI, innately there's going to be people in the room who have some fears. Many of our workers in our agency are represented by the union. And so there's a fear that AI could replace them in their jobs, right? And so we've started talking about it not as artificial intelligence, which creates this sort of innate replacement, you know, fear, but intelligence augmentation. So enhancing the human potential and letting them know that we still need them. We very much need them. We need their strong empathy and interaction with the humans that we serve. And we need them to not be fearful. We also have to think about, you know, in government, we have a credibility problem, right? Like, people innately think government, I don't trust the government, or they really trust the government, or there's a fear of the government. And so, you know, we have to make sure that when we're deploying AI or any service externally to those that we serve, we're doing it thoughtfully and intentionally so that we don't create damaging repercussions downstream that only further prevent us from being able to provide the services that those that come to seek out our benefits so desperately need. So the maturity, the readiness is something that I think we can't spend too much time on. We need to start there and get really comfortable before we start taking the really cool, fancy new thing and dangling it outside. And the one other thing I just have to say, because I experienced this while driving up here. So I think that while, you know, most people, when they hear AI, think of, you know, something that isn't all that scary, and it's not another human, right? I did notice many people driving Teslas who are using the carpool lane, and I think they equate AI to a human, because clearly they were single drivers and they did not have another human in that car. So if any of you were one of them, I saw you when you drove by.
So, Taylor, that was a great way of looking at from the public agency. And one thing which I truly feel, and when I see in my own agency, is the workforce knowledge and talent gap. And I just wanted to delve on that part, where how, as HC as an agency, how are you preparing the workforce to kind of be prepared for the next wave? Because this is inevitable. This is going to come. We are going to accept it. How can we become more efficient? How we can be more in tune with what's happening in the marketplace? And our talent and workforce is very much aligned with that. So are there any specific thoughts over there?
Sure. So, I think for us, again, we're in our infancy. So creating safe sandboxes for our team members to experiment in, I think that's important. Partnering with other agencies or private sector entities. I know back in the back of the room, my partner back there, Les from DOH, has given me lots of great ideas about things that they're doing with specific use cases in DOH in order to create that muscle memory and get the workforce ready. We also have, private sector entities that are willing to come in and create innovation labs for us within their, sandbox, so to speak, so that our developers, our team members can get comfortable with the different technologies. So I think there's many approaches. One other one is we've partnered with the University of Washington. Specifically, they have a program, a new graduate certificate program through the Evans School of Public Policy around leading public innovation. It's a 9-month program, and they, as a part of that, have been bringing in, other entities. So their director from the Master in Human Center Interaction and Design school, and teaching, kind of about how AI can be applied in, government or in public policy spheres, and just really getting as much exposure to our team members as possible in a way that creates that safety net, so that the things that they do aren't having external impacts when they're not ready for them yet.
Awesome.
Yeah, talent's a big issue for us. I think, unless you're DOD, I don't think other agencies have done a very good job of communicating the exciting things that are happening in government, in AI. I think there's probably maybe some misconceptions that if you are a data scientist coming to HHS is where your career is going to stall, not necessarily grow. So I do think that we can be more, speaking of being transparent, more transparent about the interesting research projects and use cases that we have underway at the department, but also finding ways to help different data scientists and others with their skill sets recognize that HHS and federal employment is a viable path to using their skill set, growing their skill set in a way that benefits the greater public. And that there can be a pathway for them to have meaningful work experiences, in federal employment. And so I think for us, that's more of a PR messaging thing. I think that, we mentioned some of these top AI companies, and I think those are places that you obviously would look. But I do think, the department, we do have our work cut out. Attracting talent and helping them work on things that are exciting, even if there are things that are classified that we can't mention. We have to find ways around that, just because it is part of it is messaging when we think about attracting, hiring, and retaining the talent and skills that we need in federal employment.
I'll share a few thoughts. First of all, the conversation around workforce. Talent acquisition and talent retention is not a local conversation. I can assure you, everywhere I go around the country and even around the world, I was in Europe earlier this summer, this is the number one consideration for everyone I speak with. How do we enable organizations to retain the talent they have, nurture them, bring them to somewhere new, and then attract additional talent into their organizations? It's incredibly important. We see it everywhere we go. This talent, modern talent, the folks who are out there in the market today, they want to work with these technologies. They want to work with these modern capabilities. I think it's incumbent upon organizations to think about how they can do that. Something that we tactically and explicitly advise them is to create these sandbox environments where they can invite private industry partners into their environments and allow them to work with their data and their people and get up and running in their environments. Explicitly set up a situation within your organization where you expose your data to potential partners who you can bring in to help you. I think it's clear, it should be clear to everyone that there are a handful of companies who are going to be the leaders in this space for a number of different reasons. I would number them in the dozens. And every organization needs to find ways to accelerate their ability to work with them, to evaluate their capabilities, to bring their capabilities into their environments, and ultimately those capabilities are deployed against their workforce. And this is how you'll figure out who is offering you value. And everybody's looking to bring value into their environment. So you can do this. You can create your environments as a part of being prepared. And it's a strategy that everybody can employ.
Thank you for that. With the interest of time, I will open it up for the audience to ask any questions you may have.
Hi, thank you very much. Andy Scott, Pharmacy. Practical applications of AI in population health. Can one or more of the panelists illustrate some examples of practical applications of AI in population health? Thank you very much.
Sure. So let's go back to the horrors that we've all lived through with supply chain issues around getting COVID immunizations and therapies out. We learned that we don't know where product is. We don't know where drug is. The only reason that we had an inkling was because there was centralized distribution of those things, so we knew who we sent it to. But we also realized that things got sent places that there may have been greater or lesser need. And so right now at the department, we are working on different use cases that include ways to optimize how we deliver certain therapies, vaccines to areas of needs in situations like that. And I think the applications for public health are huge when we consider that there are drug shortages all around. Sticking with the theme of drugs, I'm a pharmacist. One of the things that I'm always surprised that we don't talk about enough is, antibiotic resistance. My goodness. And so, there is work underway at FDA. How can we use AI to help us understand better where we need to be looking, whether it is in our livestock populations and feed, whether it's in other different areas that we use some of these antibiotics in excess. So understand how we need to be changing and understanding policies around the thresholds for how we're allowing some of these things to be used. It all contributes to public health issues. And I'll also give you one more on we have good processes in place to track events when we think about adverse events of drugs and such. When we think about large-scale cosmetic use or just regular products that are used out there in mass, we don't have great ways of reporting that this sunscreen wasn't very helpful, this lotion, this soap product, this toothpaste, whatever it is. And so that's another use case where FDA is working on how do we really track different data sources to understand where there are trends in consumer goods that are causing products, causing problems, and how those products are being used, because we don't kind of track some of those reports the same way we do for things like medicinal products or therapeutics. And so those are some real practical public health applications that are really that can help us prepare to deploy interventions and products and services where needed, and also help us get ahead of being able to identify real time very quickly where there might be consumer goods in use that shouldn't be or might need to be reevaluated in a sooner timeline.
You have 1 minute left.
I'll just quickly add on that, and I'll build on some of the keynote presentation from Jonathan. Let's talk about clinical trials. Let's put a public health perspective on that. I've been told, and maybe someone in this room can correct me, our national participation rate in clinical trials is something around 4%. I think it's in everyone's best interest that we increase that. We bring more people, we make it more accessible, and ultimately, through that accessibility, we're able to deliver better products to market in the healthcare domain. And so I would suggest that clinical trial patient matching and things of that nature are in fact public health considerations. And as we heard, AI is making tremendous strides in bridging that gap and bringing more people and allowing them to get access to these capabilities.
Perfect. So let's end up with a fun, real 30-second question. If you're on the UW campus and if you are a coach of the UW team, what will be your team's walk-up song and why? Over to you.
Me?
So for me, it would be Alabama's I'm in a hurry to get things done. I rush and rush until life's no fun, because that's what it feels like every day in my life, and I'm sure the team would feel that as well.
There you go. Over to you.
Oh gosh, well I guess I talked about resources, so I don't know, money.
That's fine. Sasha.
I'll go with the classic Queen. We are the champions. When I look at a lot of what we do here, we everybody in this room has the opportunity to, persevere, deliver systems that are more attuned, and then strive for access to these new capabilities, which are so transformational. I want to empower everybody to go out there and do their part to make these things happen within their own organizations.
Awesome.
Perfect. Thank you. On that note, excellent panel discussion. Give it up to our panelists.